The Centers for Disease Control estimates 50 million Americans live with chronic pain. Now, many think that you must resort to surgery to relieve the pain, but what if there is an alternative to going under the knife? We've got regenerative orthopedic specialist Dr. Chris Wolf here with some ideas on pain management. Good morning.
Good morning.
Thank you for joining us, but first let's kind of lay it out there for people. What kind of pain exactly are we talking about here?
Well, we take care of a lot of different types of pain. We focus mostly on the orthopedic and sports type injuries, so arthritis or people who have running injuries, sports injuries, anything that keeps you from doing the things you want to do or need to do for your life.
And when you're talking about alternative measures, I'm reading about things like regenerative options. What exactly does that mean? And I mean, how serious of an injury can you use a process like that on?
Well, sure. Well, sometimes there are things that you have to have surgery.
Right.
And so we do evaluate every patient, but there are things in science now and things that we can do to try to minimize the times you actually need to go to surgery. So regenerative medicine, one of the pieces of something we do is we utilize parts of your own body, your own healing mechanisms to try to get beyond that pain and really keep you active doing the things you want and need to do for life.
So are you talking about PRP injections, stem cell injections, things like that to help, say, rebuild cartilage or, those types of things?
Right. We use stem cells from your own body, and also PRP, the platelet-rich plasma, is part of that, essentially that cocktail that stimulates that healing process. So we do utilize whatever measures are needed for that part of your body to try to do that. For example, knee arthritis, there are certain things that could be beneficial versus a tennis elbow. So there are different areas, different ways to heal these injuries.
Yeah, and what's amazing, I know we kind of mentioned, 10 years ago, this wasn't even possible. Now you're being able to use measures like this and keeping people out of surgery, including yourself, each and every day, which, I mean, that's truly incredible.
It is. We've come a long way in a really short period of time. We as a group have been doing this for over 10 years, but it is an evolution. It's been evolving over time.
And as far as a price point too, because I know when you look at something, it's surgery, sometimes I know even me personally, my eyes kind of get wide, and then you're looking at regenerative measures like you're talking about. Where do we kind of fit in that line?
It always depends on what you need, but it's going to be less than most people's deductibles for surgery. But really, it's not always the financial cost, it's the time that you have to be out of work for surgery as well. So financially, there's usually a benefit to considering something like this, but also there is that aspect that the recovery time for this is much less than having to go undergo a full-blown surgery.
Wow, all right, truly amazing the things that they can do these days, where technology is these days. You can find even more information if you check them out. Bluetail Medical Group, that is in Chesterfield, and again, they'll take whatever issue you are dealing with and give you a full analysis and kind of move forward from there. So, Dr.